All right, welcome back to another episode of Black Life Amplified. It's a town hall series hosted by the African American Leadership Forum. My name is Brittany L. Wright with Insight News. And before we get started, I want to give a very special thanks to our sponsors, the Minneapolis Foundation, North Point Health and Wellness, and Children's Minnesota for making this town hall possible. I also want to give a very special thank you to our community partner organization to include North Point Health and Wellness, Children's Minnesota, Insight News, Gray Matter, the Minnesota Spokesman Recorder, and Minnesota Community Care. Now, if you didn't get a chance to watch last week's conversation, we talk about the trial and public safety. Now, this is part 2 of the conversation, this time focusing on how community members plan to lead during the Derrick Chavin trial. You can view the full conversation on the African American Leadership Forum Facebook page or YouTube channel. Now, today's episode of Black Life Amplified is focused on COVID-19 and vaccine equity. But up first, we want to give a very quick update on the Derrick Chavin trial. So the final jurors have been selected, and opening statements for the Derrick Chavin trial are set to begin on Monday, March 29th at 8 a.m. Derrick Chavin is the former Minneapolis police officer who was seen on video kneeling on the neck of George Floyd for 8 minutes and 46 seconds. Chavin will now face 3 charges in the murder of George Floyd: second-degree unintentional murder, third-degree murder, and second-degree manslaughter. For more updates on the Chavin trial, visit Black Life Amplified's community media partners, Insight News, and the Minnesota Spokesman Recorder. So now we all know that racism is a public health crisis, and on today's conversation, we're going to focus on public health and public health equity. Joining me on today's panel is Ms. Adrienne Thornton, who is a nurse and infection preventionist with Children's Minnesota, Stella Whitney West, who is the Chief Executive Officer for North Point Health and Wellness, Ruben Moore, who is a President and Executive Director of Minnesota Community Care, and Dr. Zeke McKinney, who is a faculty physician and clinical investigator at Health Partners. Welcome, panelists. Thank you for being here. Welcome back to the town hall space. We have officially been in this pandemic for a year, which is so crazy, right? What a year it's been. So I'm really curious to hear your thoughts on how long we will be in this pandemic. And first, I want to ask Adrienne. So as an infection preventionist, your professional world is all things pandemic diseases, preventing them. And I'm curious for you specifically, how did the COVID-19 pandemic shift your work? And how do you anticipate things will look a year from now?
Thanks, Brittany. Well, let's start with, we are aware of the pandemic for a year. I personally think it was here long before March, perhaps starting in January or maybe even December of 2019. And so I like to say that we have been aware of the pandemic for a year. We've actually been in it for much longer, though. And from an infection prevention standpoint, it has been a roller coaster. You know, in the beginning, it was really busy. It was all hands on deck. It was planning. It was preparing. It was writing new policies. It was making sure that we protected our staff as well as our patients. And it was difficult because the guidance was changing literally from day to day, sometimes from hour to hour. And so that was the incline of the roller coaster. And then it kind of trickled down. We didn't have a deep fall, but over the summer, in June, it started to slowly come down just a little bit in the infection prevention world as our policies were standard, our work was standard, but we were still, doing a fair amount of work. And then around the holidays, the roller coaster went back up because, as people started to gather and do family activities around the holidays, of course, the number of COVID cases inclined. And then for maybe a week between Thanksgiving and Christmas, it was kind of, the roller coaster was at the very top, just kind of teetering. And then vaccines hit and it just zoomed down and went back up. So the roller coaster ride continues. We are now heavily focused on getting as many people vaccinated as possible. And it would seem as though that would be an easy thing to do. But the difficult thing is getting our people to get vaccinated. At Children's, we We started out with vaccine clinics for our employees, and we have recently expanded it to our patients. And it would be wonderful if we could get all of our Black and Brown and Asian patients in, or even our employees, but we are having to have multiple conversations around vaccine. I wouldn't say hesitancy, but vaccine fear, vaccine concern, and, trying to, give people the education they need to make an informed decision. And it's very difficult. It is not an easy thing to do. And I understand people's fears and concerns. They're the same ones that we have all had, and it's not that I'm vaccinated and, I'm okay. Those fears still exist. But the one thing that I know is that by getting vaccinated, I am protected from death related to COVID. I am protected from severe disease related to COVID. And for me, that is the bigger picture. And so just trying to get people to come in and get vaccinated, it's been a little bit of a task, but you know what? We're still on the roller coaster ride. It's not over yet, and that's okay. This is my job. I took this job because I love doing things like this. And so being engaged with my community within the hospital and without the hospital, and talking about COVID and COVID prevention and treatments and therapies, and what should I do for this and should I do that? I love it. And so I'm just holding on tight to the roller coaster, making sure that I don't fall out in the process. But it has definitely been a very, very busy year since we knew about the pandemic.
Well, I can only imagine. And thank you so much for your service and all the work that you've been doing. And thank you to all of the first responders and people who have, things haven't slowed down. They've actually activated even more since the pandemic began. I want to ask Dr. Zeke, now you've been on previous town halls and have spoken to us about the importance of vaccine and herd immunity. For those who haven't heard you speak, how do you define herd immunity? And do you think we'll be able to attain it globally by 2022?
Yes, ma'am. Well, first, let me say, thank you for having me again. And speaking of herd immunity, I think some people don't like that term just because, nobody wants to feel like they're animals in a herd. So I think nowadays we like to say community immunity. But the concept of community immunity is really around reaching a level of immunity in our entire population so that the virus has nowhere to go and to spread. With this virus, that number is around 80%. It varies depending on how infectious a virus is. And so with the new variants, that number may vary a little bit. But ultimately, that's why it's so important for everybody to get vaccinated and to make sure that, we aren't spreading the disease around, especially because there's still segments of our population who can't get vaccinated. That's particularly children, though, of course, there are always going to be some people who can't get it for medical reasons. It looks like, coming onto the summer, we're going to probably have a supply of vaccines outweigh demand. So at that point, I'd like to think, at least here in the U.S., everyone who wants one will be able to get one, but maybe it's more realistically by later in the year. Last Halloween I joked probably by this coming Halloween things will have calmed down a bit, but that's just here for the U.S. Globally, there are going to be a lot more challenges with distribution, whether it's because of money or storage or a bunch of other reasons. And so it may still be a couple years, maybe even 3 years, some people have predicted, before the whole world really reaches that sort of level of community immunity.
Wow. Okay. So we've definitely got to do our work and make sure that each of us are doing our part to achieve that community immunity. And I love that word. Thank you. Thank you for offering that. Ms. Stella, I want to ask you, in our production meeting, you mentioned the possibility of being fully open by the summer of 2021. Now, was that something specific to the policies that are taking place at North Point, or could this be state and even nationwide that we become fully open by the summer? Uh-oh, I think you're on mute, Miss Stella. I can't hear you. Still can't hear you, Miss Stella. We'll wait and come back to you in just a moment. I want to ask Ruben, what are your thoughts on how our government, both locally and nationally, have been handling the pandemic? That's the first question. And then by this assessment of leadership, when do you think the pandemic will end or that we'll return to some form of normalcy?
In the last 90 days, we've really seen a complete 180-degree pivot in terms of our federal leadership around the pandemic. I would say that the prior leadership was near mismanagement, not unfocused strategies, unfocused communication, and unfocused really approaches to really reopen up our country, get folks vaccinated, really assess and provide the support necessary to our states in order to ensure that we are doing the best we can locally here to get folks vaccinated and keep our communities safe. So I would say 180 pivot at the federal level. At the state level, we've had a really good governor who's done an amazing job of keeping our state focused on the risk, providing great guidance in terms of executive orders to ensure that the amount of exposure and the prevalence of COVID-19 in our communities does not reach an uncontrollable rate. And getting access to the vaccination. We've had no issues in getting access to the vaccination locally here. And that's a really important piece. And so in terms of leadership, I would say the new change in terms of our federal leadership went from a D grade to maybe a B. And in terms of our state leadership, I would give our governor, and especially our Lieutenant Governor, Peggy Flanagan, an A for the efforts they're attempting to work on and employ in our communities. Still with a lot of work left to do in terms of health equity, but I think they've done the best they possibly could given the resources they were provided.
Awesome. Well, I think, we all had concerns in the initial rollout of the vaccine and initial concerns in the way our federal government especially responded to the pandemic in general. Like I can remember it was probably around this time last year that they were just notifying the public that we should be wearing masks, and the question had been raised prior to that announcement coming out, should the public be wearing masks? And the federal response was no. And a part of that was they didn't want people going out and purchasing all of the N95 masks and taking supplies that our medical professionals need. And that's valid. But certainly there was a bit of misinformation that went out for a while. And to Adrian's point, it's been about a year since we knew of the pandemic, but the COVID-19 virus certainly was around before that. So I'm certainly glad that things are starting to improve and that our leadership is becoming more responsible because lives are at stake by the end of it. Ms. Stella, I want to go back to the question I asked you. What do you think about the possibility of us being fully open by the summer of 2021?
So I do think when you say fully open, I don't think we'll be fully open by the summer of 2021, which is really just a couple of months from now. I do believe that we will certainly have more people who will have been vaccinated, but we're still going to need people to continue to wear masks in certain environments. We're still going to need people to adhere to the public health guidelines, washing your hands, using hand sanitizer. Matter of fact, those kinds of guidelines should never go away. These viruses are always going to be present in our environment. This pandemic, COVID-19, was a painful and is a painful wake-up call for us. But some of these good public health guidelines are the type of guidelines that we should be using all along, making sure that we are aware of our environment, making sure that within our homes and in our work site, that we are stepping up and making sure that we have that protection. What I do hope that we will be in a place where more people, it would be open for more people to get vaccinated. I do think that the rollout has been choppy, and I was able to hear a little bit of what Ruben was saying in terms of how our government, how our state government has done. I know with the community health centers, we have had direct conversation negotiations with the state. And so the community health centers have been able to operate within a space that is closer to the community and the people that we serve. But I do think that the government could have done better all the way from the federal level to the state level. And so it has really contributed to a lot of the confusion that the public has.
Thank you. And I also want to ask you, Ms. Stella, what would you say is the correlation between politics and public health? So we hear Ruben speaking on how various state leaders and also even federally, things were a little rocky in the beginning, but they've gotten better. But what does the correlation mean to you?
It's at the top of the list. We talk about social determinants of health, that is your zip code, the environment, your economics, all of that contributes to your health outcomes. But I would say at the top of that list is what we call the politically determinants of health. That is, who are the policymakers? Who are the elected officials that are responsible for the laws and the policies around your access to health care? Let's just take the Affordable Care Act, for example. What a heavy lift that was, and how politically charged that has been. And we're just talking about making sure that all people, regardless, have access to health care, basic human right. Let's talk about the pandemic. Let's just talk about wearing a mask. How did that become a politically charged item? That's just good public health policies and guidelines. Yet, we know that it really depends on who is in office, who is making policies, and it should not, because we're talking about decisions and policies that are a matter of life and death. So I always tell people that you need to pay attention, and let's not just vote every 4 years in the presidential election, but you should be looking at all across the board who has policies and who are the elected officials at your local level, your school board, making sure that they align with your values. It is extremely important. And we know right now what is happening is voter suppression. This is real, people. So now we're going to have to fight those battles that our ancestors fought. And now we're coming back. This is 2021. And we're trying to, again, fight just to have the legal right to vote.
It's so unreal sometimes how far we've come and yet how far we've regressed as a society. And I think we just have to continue to work just as hard as white supremacy and these opposing forces to ensure that our voices are being heard, because even if you may not care for a particular candidate, at the end of the day, their values and beliefs on health are going to impact your values and beliefs on health and your access to quality care. And unfortunately, many lives were lost simply because people's right to vote was suppressed, or because people didn't get out to express their right to vote for a candidate who believed in science and who believed in saving the lives of people. So if you're just joining us, we're talking about how long will this pandemic last? And we've heard some varying answers from, things could look a lot different by October, by Halloween of this year, but globally it could be up to 3 years before we really start to see things resemble some form of normal. So we are definitely in this for the long haul and need to continue moving forward. One of the best ways to do that is by getting vaccinated, or getting those who are able to get vaccinated access to a shot. But there's a lot of misinformation out there on the COVID-19 vaccine and on vaccinations in general. So we are going to dispel some of those myths. If you are watching and viewing this from home and you have a question, please put it in the chat. I'll do my best to monitor it and make sure that your questions or your comments are uplifted as well. But I want to ask all of our panelists, because I understand that all of you have received a vaccine. I'm very jealous. So please tell me, how many doses have you received, and what vaccine you've received, and what side effects, if any, have you experienced? And I'll start with Adrienne.
Thanks, Brittany. So, as our viewers may remember, I am also participating in the AstraZeneca vaccine trial. My daughter and I are, and I was unblinded from the study so that I could receive the Pfizer vaccine at work. And so I have received 2 doses. And I had no real side effects. The one side effect was that I was really tired. I immediately, like a couple of hours after receiving the vaccine, needed to take a nap. And I had some arm soreness, and then I slept on the arm that I received the vaccine in that night, which was not a good idea. And so when I woke up the next morning, I had a nice little goose egg type swelling under my arm, but that went away after about a day and I was fine. And that was with my first dose. And then with my second dose, I had no side effects at all. I wasn't tired. My arm was a little sore right after the injection. But other than that, and I did not sleep on that arm after the second injection, so that helped. But I've been fine ever since. And so, yeah, I'm excited. My family, my entire family is vaccinated. My daughter is also a part of the AstraZeneca trial, and she was going to get vaccinated at Alina because she has some comorbid health concerns, and so they were able to put her on the list, but she too was unblinded, and so she actually received the AstraZeneca vaccine as part of the trial, and she received 2 doses. And with the first dose, she had some pretty strong reactions. She had fever, she was tired, she had some body aches, and so she just took Tylenol and went to bed, and after about a day and a half, she was fine. But I am happy that we are all vaccinated and doing well, and can, feel a little bit safer when we go out into the world.
Yes, that's awesome. That's good to hear. Dr. Zeke, tell me about which vaccine you received, how many doses, and if you experienced any side effects.
Yes, ma'am. So as part of working on the AstraZeneca trial, the one that Adrian's talking about, I actually got vaccinated pretty early. I got my first dose the same day as Joe Biden, so that was back in December. So I've had both
presidential.
Doses. Yeah, well, almost. I feel a little bit important. No, so I had both doses as of January. With my first dose, I didn't have any side effects at all. The second time, my arm was a little bit sore where the vaccine went in, but then the next morning I woke up and I felt really tired and a bit sick. I mean, not any specific symptoms, but like you just kind of feel sick sometimes. But I had to go to clinic, so I popped a few ibuprofen, and honestly, within an hour, like by the time I got to clinic, I felt totally fine. So it was, maybe a little tired still, but it was pretty minor. And to be honest, I personally, I know people are concerned about side effects, but when I weigh that against getting COVID or potentially the long-term consequences of COVID, I feel like it's not even a question.
That's great to know. A lot of people have expressed deep concern over those side effects. Ms. Stella, how about you? Which vaccine did you receive? How many doses? And did you experience any side effects?
Thank you, Brittany. So I too was vaccinated at work. North Point made it available to all of our employees. And so I got the Moderna and have received both doses. My second dose, I received February 19th. It was delayed by 1 week. And the first dose, I didn't have any side effects at all. A little bit of soreness in the arm. And I remember that my staff were a little concerned because after you receive your vaccine, there's a 15-minute waiting period where you're under observation. And we have that at our clinic as well, and where staff will come by and check to see, just want to make sure that nobody is having a severe reaction. And when I got my first dose, I just took off, and I'm walking through the clinic and doing things, and somebody came after me and they said, you're supposed to be sitting down somewhere. And I said, what? Then I remembered, oh, okay, I'm fine. It was the second dose that I got. I woke up the next day, felt fine, but I should have heeded the warning. And so it was on a Saturday. I went about my day. And I remember I was in Target and I started to feel really, really tired and started to have some chills. And I remembered, oh, you were told that you might have these kind of side effects. You need to go home. And so I finished my shopping, went home, took the Tylenol, just like Dr. Zeke said. And then I went to bed and I was fine. I woke up and everything was fine. You will get, again, the soreness in my arm lasted for a couple of more days, but no other side effects whatsoever.
So thank you. I want to ask Ruben the same question. Which vaccine did you receive? How many doses? And did you experience any side effects?
You know, I had an opportunity to get the Moderna vaccine here at Minnesota Community Care. And I liken the Moderna vaccine being a messenger RNA vaccine to kind of like an email that's sent to your body with an attachment. And so when my body downloaded that attachment, I had an immune response. But for me, that vaccine kind of gave me a lift in energy. I was more energized and kind of based on my immune response. And so I found myself staying up overnight, working 24 hours a day. That was just my unique response to the vaccination. Well, the second vaccine for me, in addition to kind of having the energetic immune response, the second actually put me a little bit to sleep. And then I went right back to that high energy response. And so what it said to me is that, hey, my body has recognized that it's learning and that it needs to start to adapt. And I felt really good about it. I felt like I felt a little bit more resilient, which was a positive sign in terms of the vaccine's effectiveness on my specific body.
That's awesome. You are the first person I've heard who felt even better immediately after taking it. So that's definitely good to hear. Dr. Zeke, now I want to know, when you feel side effects, is that because you're being injected with the COVID-19 virus, or does that have something to do with your body being receptive to the medication? What exactly is the side effect business about in the first place?
Yeah, so like Ruben said, essentially the vaccines are giving your body the tools to sort of reproduce the proteins of concern that will allow your body to attack the virus if it sees it. And so the side effects actually are a good indication that you are having an immune response and are developing immunity, just in the same way that you'd get effects from having the virus. Of course, these side effects are going to be a lot lower because it's not the whole virus, it's just one small part of it. So we know how to attack it. So I know the side effects concern people, but I would say that tends to be a good sign. Of course, not having side effects doesn't mean anything, and I wouldn't worry about that either. But so overall, I want people to be reassured. Getting side effects means the vaccine's doing what it's supposed to.
And would you say that there are certain vaccines that are better than others?
Ooh, that's a tough question. No, it's not really. So this is what I've been talking about for people the last couple months. So everybody's really jazzed up. They read in the news, they say, oh, 60%, 70%, 80%. Look, that's all. I wouldn't mess with that. I think the question we should be asking is, do the vaccines work or not? And my answer is all of them work, I think, pretty good. And so how do we slice that up? Well, look, first of all, vaccine efficacy can be looked at. Does the vaccine prevent disease? And those are the numbers that people are hearing reported and the ones that they're, thinking about, oh, maybe this is better than that one. But in reality, most vaccines out that exist in the world almost never reach 100% with that. In fact, the influenza vaccine, because of the nature of the virus and how we develop it, is usually closer to 30 to 50%. But all of these vaccines that are out there are well above 50%. And in that regard, I would say they work from that perspective. But an important number to look at is also, does it prevent severe disease, hospitalization, and death? For the 3 vaccines that have been approved here in the U.S., that is Pfizer, Moderna, and Johnson & Johnson, those numbers are in the high 90s. AstraZeneca just reported yesterday that number is actually 100%. And then the third thing, of course, we have to wonder is, do these vaccines prevent transmission of disease? And so that's, really important, because that's how we're going to be able to get back to, normal life and closing down this pandemic. So far, AstraZeneca is the only one who's, from a manufacturing perspective, has put out data, it was about a month and a half ago, early February, showing a reduction in transmission by about 2/3. Mayo Clinic came out with a study about 2 weeks ago showing that within their system for the 2 mRNA vaccines, Pfizer and Moderna, that transmission was reduced. And from a biological perspective, this makes sense. Most vaccines do this, and we would expect these vaccines to do it as well, with reducing how much your body is reproducing the virus once you get immunized. So ultimately, I don't want people to get hung up on, oh, is this one better than that one? I mean, at the end of the day, if you can get a vaccine today, get one. Don't worry about which one it is.
Now, that's a really good point because not everyone actually should get vaccinated. And this is something that I recently learned. Ms. Stella, I want to ask you, should those with chronic illness or disease get the vaccine without speaking to their primary care physician? The way I originally understood it is if you have any type of comorbidity, then you're more at risk. And so in my mind, like, you should absolutely go get it. But it sounds like that you could have adverse effects to the vaccine. And so certain types of people should actually check with their doctor to make sure that the vaccine is right for them. Is that accurate?
Well, I want to say that for the majority of people that have comorbidities, it is safe for them to receive the vaccine. So I want to just say that first. Certainly, anybody that is being treated for any type of chronic disease, you want to consult with your primary care provider, particularly if your treatment, say you're being treated for cancer or any type of medication, and if you're receiving multiple medications, you need to be checking in with your primary care provider. It is just good practice anyways. I think if you look at the CDC website, you will see things on there that they consider for folks to be at risk for COVID-19. Hypertension is one of them. Did I check with and I have hypertension? Did I check with my primary care provider prior to getting the vaccine? I did. I checked and made sure, but and was told absolutely that you should get the vaccine, not a problem. So it's a quick phone check, and a lot of providers now. You can do it through telehealth. You can send an email through if you're using MyChart or whatever the patient portal is. But yes, but that should not stop anyone because oftentimes people want to self-diagnose, and they'll say, I hear that a lot. Oh, I'm on this medication and I'm doing this, and so I shouldn't get the vaccine. And then when you ask them, well, did you check with your primary care? Well, no, I don't really need to check. I have enough, but understanding that those same chronic diseases also put you at an increased risk for disease and death from COVID-19.
You bring up a really great point about self-diagnosing. I was actually exposed to someone with COVID a few weeks ago because they self-diagnosed themselves with a sinus infection. And it's sinus season, and they've gotten them historically throughout their life, except this time it was actually COVID. And thankfully I got tested and I didn't contract it. But I think people have to be especially mindful. We are in a pandemic. And if you have access to care, you should definitely take advantage of it and not just assume, even if your body, you're used to it behaving in a particular way, it's worth the extra precaution to just go get tested or to check with your doctor to make sure it's more than a cold or a sinus infection or something else. Because you never know who you may be. You may be okay, but you never know whose life you might be putting at risk by not doing your due diligence. I want to pivot to Adrian now. You work at Children's Hospital, and I'm really curious about the babies, our small children. I recently took my daughter to a daycare just to tour it and to kind of see, what their COVID preventative measures are. And for the toddler age range, for the infant age range, and for preschool, they don't require that the little ones wear masks. And so I'm curious, as to why and how. That is it. I was taken aback a little bit because whenever I go to Target or to the grocery store, if I even bring my child, she's masked up. But at this particular daycare, she would not be. And it makes me wonder, is there going to be a point when our little ones are getting vaccinated, like within the first 6 months or, at a much younger age, like with other vaccines?
Yeah. So, Brittany, first, let me applaud you that you were able to keep your mask on your daughter. Most children under the age of 5 don't do well with that. Even at the age of 5, they struggle because they don't want a mask on. But definitely the younger children struggle a lot, and it's just difficult to keep a mask on them. And so with that in mind, and knowing that they are not huge reservoirs of transmitting COVID-19, we don't really need to focus on putting a mask on them. Even though they can asymptomatically get the disease, the science has not shown a huge amount of transmission from those age groups. There may be some, but we're not seeing a lot of transmission like we do with our young adults and teenagers. And so that's number one. And again, number two, because you can't keep masks on them. And so the best thing is just to make sure that their hands remain as clean as possible. You don't necessarily want to use alcohol hand rub a lot with those little ones because they're putting their hands in their mouth. And so now they're essentially sucking the alcohol off of their hands. And so you can use that sparingly, but you want to make sure that you're just cleaning their hands with soap and water as frequently as possible. And as long as you're able to do that, then you should be fine. I have a glam baby who just turned a year old, and he is in daycare. And of course, they don't have the children wearing masks because they're so young, but the adults all wear masks. And they have not had any issues since last March with any transmission of COVID amongst the kids or the staff. So I would say as long as they're doing really good hand hygiene and the adults in the daycare are keeping their mask on, then you should be fine. They just need to make sure they keep the hands clean of the little ones. But there is some vaccine trials going on right now. Moderna is doing a trial of infants and toddlers. And so we should have some information pretty soon about the efficacy and safety in those age groups. So it's looking promising thus far. I don't have any real data to share, but it is looking very promising thus far for those age groups to start getting vaccinated, at the very least with Moderna, in the next few months.
Well, that's reassuring to hear for sure. And I do have to say that this particular daycare provider, all of the adults in the facility were vaccinated, and they don't let other adults into the facility. So even other parents, when they're dropping off their child, they drop their child off at the door and they pick their child up at the door. And there's very little in and out. And they've had also great success in mitigating COVID. And I do want to say, for parents who have little ones, a hack to getting them to keep their mask on is I put my daughter's hair in little pigtails and I give her an adult size mask. And instead of putting the mask around her ears, I put it around the pigtails in her hair. She's still able to lift it up and down when she needs to, and it does stay on a lot more frequently. So I would say try it if you can, but it sounds like our little ones will be safe even if they don't keep it on all of the time. I want to go back to dispelling myths because there are so many as it relates to the virus. I want to ask Ruben and Adrian, as we think about Tuskegee and as we think about the exploitation of Henrietta Lacks, how would you say that this has shifted the way that vaccines are viewed today? Adrian, I know that your great uncle was a part of the Tuskegee experiments, and so I'll start with you.
Okay, thanks, Brittany. It was actually my grandfather.
Your grandfather, yes.
Yes. As a result of some of the misuses of human subjects in the past, there are a lot of stops and checks along the way to ensure that we are not repeating history and using people as guinea pigs. And so when people ask about the safety of the vaccines, if you looked at everything that they have to go through to get approval for use of these vaccines, it is amazing. There are stops and checks all the way starting with inception of the vaccine all the way up to the time that they administer it. And since COVID is new and it's technically not approved for use, it's approved for emergency use, the CDC is still closely monitoring it, as well as the companies. They are still monitoring it. They're still gathering data. They are still monitoring the people that were in the trials. So for instance, my daughter and I are in the AstraZeneca trial. And even though I've been vaccinated with Pfizer, both of us will continue to be a part of the AstraZeneca trial for 2 years. So it doesn't end just because we got vaccinated or because vaccines are being distributed in the community. The actual trial continues so that they can determine what are the long-term effects of the vaccine on people who have received it. And so with that in mind, I just want to let people know it is very safe. I had someone say, well, I don't want to be a guinea pig for science. And what they're not realizing is that we're already guinea pigs. We are guinea pigs in COVID-19 disease. We are the biggest community that has most of the hospitalizations by race. We have more of the deaths. We have more of the disease. And so we are already guinea pigs. And if you can get the vaccine, you should get it, because no one can use you if you don't want them to. That's number one. None of this will happen. The IRB approvals were put in place, and what's amazing to me is that you see non-Black people doing whatever they can to get the vaccine. They are cutting lines. They're standing in line for hours. They are gaming the system if they can to try and get the vaccine. And then, other groups are not as adamant about getting the vaccine. And people should question, well, why are they so quick and ready to get the vaccine and we're not? Do they know something we don't know? And the answer is yes, they know that the vaccine is safe and effective, and that even if you get COVID after you get the vaccine, you won't be critically ill and you will not die, which is the most important part. Because again, COVID vaccine in just 1 year has come up from the back of the pack and has taken over as the leading cause of death in the United States, overtaking cancer, suicide, heart disease. It has taken over as the number one cause of death in just 1 year. And the majority of those deaths have occurred in Black and brown communities. And so it's very important for us to know that the vaccines are safe. The science is real. It is very straightforward, and if you have questions, again, I always tell people, have questions, have your fear, don't let it drive you. Find a trusted healthcare professional that you can have a real conversation with, ask your questions, search for your answers, and then make a decision.
Thank you. Ruben, I'll ask you the same question. How would you say the exploitation of Henrietta Lacks or the Tuskegee experiments have shifted the way that our community in particular feels about the vaccines?
I think that as we look at history, and history can inform so much about our present state as well as our future, healthcare has been untrustworthy, right? Conduct like what we've seen in Tuskegee experiments, and my family is from Alabama, from not too far from Tuskegee University. Conduct where we've seen the exploitation of Henrietta Lacks, letting an individual kind of experimenting on a Black woman while carrying a very deadly form of cancer in order to create the many lotions we have today, the many different cancer and other preventive drugs we have currently in our market is egregious. And we have to hold healthcare accountable, but that's not this debate. I would say that COVID-19, as stated by Adrian, is the number one cause of death right now for African Americans. It's more deadly than gun violence, more deadly than car accidents, and we need to wake up. And it is important to say, look back at history and be informed by history. It's relevant in our present, and we should still talk about those elephants in the room. But we need to make a pivot and recognize that this vaccine has proven its test in terms of science. Science is a lot more advanced than it was in 1970, 1980, and 1990. It is not approved, of course, by the FDA, but it is approved for emergency use, and it is preventing death, right? And so, And many times you have to be untrustworthy, I think, absolutely, of the federal government, of the state government, of the health industry. But in this moment, I think we need to extend a little bit of our trust back to these institutions.
Thank you. You know, we definitely can learn from our history, and it is affirming to know that different provisions have been put in place to ensure that we don't go back to that place of being exploited in that way. So for those who are interested and who have been able to ask the questions and push through fear and become educated, who want to get vaccinated, Dr. Zeke, I want to ask you, is insurance a factor? Is cost a factor in getting the vaccine? Who's paying for all of this?
Yeah, I cannot emphasize enough that this is a concern people have, but it's one they shouldn't. The federal government is providing the vaccine free of charge to everyone in the United States, regardless of what their immigration status is, regardless of health insurance status. You know, if you go to get a vaccine, you can't be charged for a vaccine. You can't be charged fees or co-pays or co-insurance. We can't deny the vaccine to anyone who doesn't have insurance. The only thing that people can do is try to bill people's insurance, but even if there's some leftover amount, that ain't going to you. So the vaccine is free. Don't let anyone tell you differently. Free, free, free. That's it.
That's very important. Cost shouldn't be a factor in us getting to that community immunity. It's something that we have to do, not just for ourselves, but for our family members and our community at large. And so it's great to know that cost won't be a prohibitive factor in making sure people get vaccinated. I want to move forward. We've got a little less than 15 minutes left in our conversation, and I want to talk about vaccine equity and ensuring our community has access to the vaccine. So Ms. Stella, I want to ask you, who is currently eligible to be vaccinated, and how can you find out more information to see when you in fact are eligible?
Right, Brittany. So that is also a moving target. And we have at North Point Health and Wellness Center, we are part of the community health centers in Minnesota, and Ruben and his clinic are as well. So we have been working directly with the Department of Health to make sure that access to our patient population, which is more people of color, so over 90% of the people that North Point serves, and we serve close to 30,000 people who come into our clinics and our human services, our food shelf, are people of color. And so we have had some success in being able to do that. And I would encourage people to constantly look at the Minnesota Department of Health website, but also whichever clinic that you are a patient of or that you wish to go and get your vaccine from, is that you go to their website. Even North Point, going to our website, we do have a link on there that actually will tell you who is eligible now to receive a vaccine at North Point. But I do believe, because many of the other states are opening up, that the vaccine is available to any adult. And I do believe that by this summer, for sure, that is going to be open here in Minnesota, because we are in a race, right, with this virus, and it is mutating. And the only way that we are all going to be protected is that we make sure that as many people as possible are vaccinated.
Thank you. And I want to know specifically about the North Point location. Do you only serve Northside residents, or can anyone come to the clinic to get vaccinated?
We serve what we call our patient population, which includes mainly North Minneapolis, but we also have patients that are coming and from all over the county and even Ramsey County. So predominantly, yes, most of our patients and clients are in the North Minneapolis, Brooklyn Park, Brooklyn Center, surrounding suburban area. But we have patients that come from everywhere.
Good to know. Adrian, I want to ask you, specifically about vaccine scarcity, would you say that there are enough vaccines now for everyone who wants to get vaccinated within the state?
I don't know if we have enough for everyone that wants to get one. I think we're getting close. Adding Johnson & Johnson to the list has definitely helped, but until they can ramp up enough production to consistently get us enough doses on a weekly basis to vaccinate everyone, we cannot just vaccinate everyone that wants to be vaccinated yet. Now, with that said, I think we'll be there close. The government is working very closely with all three companies. Hopefully, AstraZeneca will get their EUA approval in the next few weeks, I think, isn't it, Zeke? Hopefully soon. And so as we add more vaccines to the list, that gets us that much closer to having enough vaccine for everyone. So we're not there yet, but we are getting very, very close.
Dr. Zeke, did you want to add something to that? I saw you were shaking your head when I was asking the question.
Oh, I was just agreeing with Adrian that we don't have enough for everybody yet. The Johnson & Johnson rollout certainly helped, and with the addition, hopefully, of AstraZeneca in the next few weeks, that will help as well. That's why I was saying I'd like to think maybe by early summer, June, probably the entire United States will have enough supply for everyone who wants one, but we're not there yet.
Got it. Now, Adrian brought up a really great point earlier in our conversation about people skipping the line or, somehow bucking the system to be able to get their vaccination first. And so I want to ask you, Ruben, how is it that some people are able to get high priority with their vaccines before others?
It's an unfortunate reality when you have such a key resource of vaccination in such high demand that folks are working with their healthcare institutions to try to find a way to be prioritized. In our organization, we have spots open for our current patient population across our 16 sites, but we also take in community members. If you come in at the end of the day, you can possibly get vaccinated if we have a couple open vials. No, it's so important. I think it's one thing to think about, getting, skipped ahead, but you should really know why you want to get the vaccine. I'm doing this for my grandmother, doing this for my mom. I'm doing this for my friends and family. And really look to get on lists, look to call your primary care providers. If you have a chronic condition, you're eligible to be vaccinated. If you're on the front line, you're eligible to be vaccinated right now. But reaching out and trying to tap into those key resources so you can get vaccinated as soon as possible. There is a state prioritization, but now that prioritization is becoming more and more open. And so it's really important that, we get on the list, you understand your why you need to be vaccinated, and you look to finding help from your primary care physician or other resources to make that final determination.
And specifically at Minnesota Community Care, you all receive federal support. And so can you talk a little bit more about what makes your facilities unique and how you're supporting your patients through this pandemic?
Yeah, we serve, nearly 40,000 Minnesotans. That's a big, big number. And we've had that opportunity to be a key partner with the Biden administration and distributing the vaccine. What we want folks to really understand is that there is no scarcity in amount of vaccines available in Minnesota. And this partnership allows us to accelerate access for communities of color, historically marginalized community, to ensure our communities have access to the vaccination. Our state tried to do its best in prioritizing people of color, BIPOC communities in response to this vaccine, but it's just very difficult because what we found is white adherence and white compliance to the vaccine protocols was higher than those of the rates of communities of color. And so now we're getting more vaccines in communities where BIPOC folks live and work. And now we're hoping to provide more and more opportunities for folks to get vaccinated by adjusting some of the protocols and prioritizations that have been informed our guidance from the CDC in the state of Minnesota.
I just want to say thank you to all of you for the work that you've been doing to ensure that our communities are getting the care that they need. This has been, I'm certain, just an unprecedented and very eventful year as professionals within the healthcare system, but you all have been handling it with grace. We've got about 5 minutes left, and so I want to make sure that I go to our audience and make sure that they have time to ask questions, and also that we start wrapping up. I did want to go back to one question that was skipped about myths about the COVID-19 vaccine. And I want to ask Dr. Zeke about the correlation between autism and vaccines, because I feel like that's a big one that people really get hung up on. And I want to make sure we dispel that myth, and also that we humanize and normalize autism also, because that's not a death sentence or anything to be ashamed of.
Yeah, first of all, autism or autism spectrum disorders is nothing to be ashamed of. It's something that we're learning more about all the time. And certainly families who are dealing with that have concerns. And that's, I think, where some of this vaccine hesitancy or concerns about the vaccines came from. It all started with a doctor from England, Andrew Wakefield, who published a paper, I want to say 1999, that said there was a link between a preservative that was commonly used in vaccines back then called thimerosal, which has a component of it is mercury-based, and the development of autism. Well, it turns out within a few years, that paper got removed from the journal it was published in. Dr. Wakefield, who continued to purport this out in the media, ended up essentially being run out of the field of medicine. And even though he's still going around talking about this and making money because he's stirring up a bunch of fears, that science has been completely unfounded. There is no link between vaccines and autism. There is no link between thimerosal and autism. However, even because of that concern and because of how concerned people have been, vaccine manufacturers took thimerosal out of vaccines almost completely since like the early 2000s. There is no thimerosal in any COVID-19 vaccines, as far as I understand. And so ultimately, that is a concern. While I understand why people want to know, well, what happened to my child, it doesn't have anything to do with vaccines. We do believe, I think, generally that autism may be related to environmental exposures, but we don't know which ones or to what degree yet.
Thank you. And if you didn't get a chance to view our last town hall, we actually had a chance to talk to an autism mom. Her son was actually killed by the police as a result of the police not knowing how to handle him having a rough day with autism. And so I think as a community and as a society, we really need to do a better job of thinking about shifting the way that we think about autism and the way in which it may impact or promote certain behaviors. Amity Dockett was a guest on last week's town hall, or from 2 weeks ago, and she wore a shirt that says autism is not a crime. And I think it's important as we talk about vaccines that we remember that people with autism are still wonderful, amazing human beings in the event that they are diagnosed with autism. But there is no actual scientific correlation between getting vaccinated and being diagnosed with autism. I want to ask a final question to Dr. Zeke. Just what is the risk of not getting vaccinated? What do you want to tell our viewers who may be on the fence about whether or not that they should get the COVID-19 vaccine?
Yeah, I think everything we do for our health is completely a risk-benefit analysis. And so not getting a vaccine, there's a couple risks. One, individually to you, there's a risk of getting COVID and potentially the risk of it resulting in death, hospitalization, severe disease, or even the long-term consequences of COVID, which I've been seeing in my work as an occupational physician working with firefighters, for example, where for them, not having perfect heart and lung function can be a real problem. But for anybody, that sort of ongoing issue can be debilitating. From a more population perspective, you have to think about the fact that, look, we all want this to be over with. We all want to hug up on our mom. We all want to go see our family, be able to go to parties, go to funerals, all these things that have been challenging for us. And until we reach that point of community immunity, we're not going to get there. And so if nothing else, even if you're like, well, it can't hurt me, I have an awesome immune system, I'm going to live forever, well, it's going to hurt everybody else. And so we all have to do our part to protect ourselves and everybody around us.
Well said. Well, community immunity is the goal. And if we each do our part, we'll be able to get there much faster and get this pandemic over with, which I'm certainly looking forward to. Thank you, panelists, for your time and your information. I want to let you know that everything that's in the chat is not a question, but an affirmation and a thanks to all of you for the work that you do and for the information that you've provided. And I want to echo that thanks and say, please continue to just do amazing work and help our community as we reach those goals of community immunity. And for those who are watching who are hoping to get additional information, make sure you visit the Minnesota Department of Health website for additional information on COVID-19 testing, because testing still needs to happen, as well as getting vaccinated. You've been watching Black Life Amplified. This is the virtual town hall series brought to you by the African American Leadership Forum, North Point Health and Wellness, Insight News, Gray Matter, the Minnesota Spokesman Recorder, and Minnesota Community Care. Make sure you join us in 2 weeks from now. We're actually going to be having our anniversary show. It's been 1 year exactly since we started this town hall focusing on COVID-19. So we're going to be reflecting on what this past year has been like. And again, looking forward so that we don't have to have these particular conversations a year from now. My name is Brittany L. Wright with Insight News. It's been an absolute pleasure to share virtual space with you all. Please take care of yourselves. Get tested if you feel sick. Get your vaccine if you're eligible and you have access. And we'll see you next time. Take care.